My name is Saleyha Ahsan, and I am an emergency medicine doctor, and I'm currently doing a PhD. So I've had a slightly picturesque journey through medicine, and it hasn't been the traditional training route. I came to medicine late. I had a career prior to medicine. I was a journalist, trained journalist, and then I was commissioned into the British Army as a non-medical support officer with the Royal Army Medical Corps. And it was whilst I was on operational service in Bosnia that I was really inspired by the work of medics out there. And that made me consider medicine. At that point, I had always planned on remaining in the army long term, and I thought medicine would be an excellent way to continue serving and being qualified in an amazing profession. So I applied to medical school. Unfortunately, at that time, and I think it still is the case, I had to leave the army. I gained a place at Dundee, which was an incredible experience. I thought if I have to be anywhere for 5 years, it has to be Scotland. I was a mature student when I arrived, and I had to adjust to being a civilian, but also a student when everyone else was at least, 10 years younger than me. Yeah, that was quite a moment, but one I definitely have never, ever regretted. And I sometimes look back and marvel at the decision that I made at that point, because it has just unlocked the most incredible world for me within medicine and academia. I then continued. I decided not to go back into the army because at that point I had begun to also resume my journalism. So I was working as a freelance journalist throughout medical school, working for outlets like Channel 4 News, the BBC, and also making independent film. But my content was always related to healthcare in conflict zones and healthcare in austere settings. And I was very driven by this notion of access to healthcare. And the reason for that really stemmed from when I was operational in Bosnia as a non-medic, but still wearing the Red Cross emblem because I was part of the Royal Army Medical Corps. And I just observed how we had access and how we carried the Geneva Conventions in our top right hand pocket. And it just made me really think about the protections that healthcare workers, whether they're military or civilian, are entitled to and should enjoy in conflict and in all settings, really. So that was the theme of my interest. And I, as a medical student, I was drawn to any special study modules or project work that was related to global health and healthcare in in non-traditional settings or in austere settings or in conflict. And my journalism started to reflect that. I started to make films. In fact, my very, very first independent film, which was screened across film festivals in 2003, was called Article 17, Doctors in Palestine, when I used my summer holiday to follow healthcare workers. And then I knuckled down, got my finals done, and then did 2 years of my foundation training in Scotland, and then moved to London to do emergency medicine, but also worked as a freelance journalist, still looking at this area, developing more of my content. And that led me to do my master's in international human rights and humanitarian law in 2011. Following that, went and worked in Libya for a year during their war as both a doctor this time. And then I would divide my time as a medic, because there was a call for medics, making films and producing multimedia content on healthcare in Libya during the war. And then I had another post, which was as a research clinical fellow in emergency medicine in Bart's trust, where the time was divided between doing research, clinical research, and doing clinical work, and which was great because I learned a lot in those 6 months about research within a clinical setting. During the masters, during my international human rights and humanitarian law masters, I did a project on the law of protections of healthcare workers in conflict, with all the various instruments and international standards that exist, the Geneva Conventions and their additional protocols. But I knew that on the ground in practice that this is fractured and doesn't always deliver. So my research now within my PhD is looking at the impact of when that breaks down. So the impact of attacks against healthcare in armed conflict. And that impact looks at both patients, healthcare workers, and systems. It also looks at the impact on surrounding countries to the conflict who absorb patients as they flee. I think it's the freedom to think at the moment. I had, like nearly everybody else within the NHS, a very, very busy time during COVID. I was working both within emergency medicine and then within critical care, and it was a very intense time. But when I started my PhD, I found a place to think. It's just a pause, a time to think, recalibrate. What am I trying to achieve? What am I trying to do? And also to sort of reflect back from when I started my PhD to where I am now, to the changes that have happened, to how refined my project has become, how specific it's become, and all the skills that I'm learning along the way, and how valuable they're going to be for me as I go forward. When I left the army and decided on a clinical career, emergency medicine seemed the most obvious place. There were many things that I brought with me that I had learned both at Sandhurst and my work as an army officer, both in peacetime and on deployment. Those were transferable skills to be able to think on your feet, to be able to plan, the importance of planning and of being organised both in yourself and then, with your immediate team. We are trained at Sandhurst to have, a strong sense of discipline, self-discipline, standards, and also moral courage, moral fibre, and all of these things I think I have carried on with me, and I'm very proud to have had that opportunity to learn those skills. That first sort of life experience was really, really key. And prior to that, I trained as a journalist. I have that to draw on as well. And I think what all of those have done and how they've contributed to where I am today is made me think on another level. I think within my PhD itself, when I think about the attacks against healthcare and military targeted attacks against healthcare, I reflect on my own time in the army and think, I cannot imagine being in an O group, an orders group, where you get your instructions for the day or for that particular exercise or that particular mission, where it would say, okay, and today your good reference is this, and it's a hospital. So I find that really challenging to comprehend, and it just makes me want to drill down to understanding when those orders are given and how they're given and by whom. And this is where the media side comes in, because I'll be tuned into the stories that are coming out. And I want to dig deeper beyond that headline or that offer of explanation. And this was something that, hit me on the first sort of day of arriving to do my PhD. My first day, and I sat down to think, and I thought, oh gosh, am I going to spend the next 3 years stating the obvious? Because who thinks attacking healthcare is good? Nobody. We know it's bad. So what am I actually trying to show? And this is where the impact of it is really important. And this also ties in with my law degree, because We have a set of standards. We have standards and laws that were established during another war, where the Geneva Conventions were, born and established. I think about the impact of not adhering to these standards. So having the time to think also brings in it what I found for me personally, all sorts of voices in my head, which come and talk to me about, am I doing the right thing? Am I actually damaging my career as in emergency medicine by taking time out to do this? What could I have achieved instead? What am I actually doing here? In Cambridge, there's all sorts of talks about imposter syndrome that are advertised. So the challenges are different. They are not the same challenges that we experience, that we share as a team. The challenges that I've experienced with my PhD are more from within, but you've got to learn to push those voices to one side and to remember, what brought you here in the first place. I am getting the impression that no two clinical academic careers are the same, and they are a construct of what can be negotiated, of opportunities that arise as and when, and also being very stubborn and not letting your academic passion go. I found within the NHS, there are definitely clinical research fellow posts around. And I did 6 months of that with Professor Tim Harris. And it exposed me to a new world. And that was within, it was a fixed clinical post. What I found valuable about that time was learning some fundamentals, being able to be present at research meetings, start to hear the language of research, be exposed to reading, the systematic review constructions, all of those kinds of things that I know we've learned about at medical school, but we don't always have a chance to do. And this was a real, this is where this was all really important. So I would really recommend that if you are tentatively thinking about it, maybe a clinical fellow research post is something to keep your eyes peeled on. What I would also suggest is reading widely and seeing who is writing in your area of interest. And that's exactly how I found my very first supervisor. They might not be from medicine. Mine wasn't. Mine was from sociology. But the sociology supervisor had been working in this area, had been writing in this area, and I approached them and we had a discussion. And then I wrote a proposal, and that was my route in. Find the people that are working in it and writing in it and approach them with an email, and then start a dialogue, and then see if there is an overlap of interest. One thing that I found challenging, I will admit, was working in an environment where I was the only doctor. My advice is that the route, even if you get onto the PhD, might not be that clear cut, and it takes constant reevaluation. It takes reflection. It takes self-monitoring. Am I actually going to get something out of this that I actually want and will actually help propel me forwards? And if it doesn't look like that, I would say my advice is to not settle, really, because it's your time, especially if you are going down the clinical academic route, because we know that we could be using that time instead for CCT for those of us that are not there yet. Your time is precious, and your ideas are invaluable, and your experience is invaluable. And what you've already gained in terms of skill set through your clinical work and your clinical training is absolutely invaluable and really wanted. So I think it's about having confidence in what you have to offer and what you can bring to the table and the perspectives that you can bring. I feel that, you know, there's room and opportunities like this across universities and academic institutions, and that your clinical side of your life is equally valued. My final piece of advice is don't overthink it. Maybe just try it, write the proposal, make the call, and go and have that first conversation. As doctors, we do tend to be older than other PhD students across other disciplines, because we will have graduated, worked a bit, got life experience, and that in itself is considered a huge asset. Funding is a really important area, and it was something that I was confused about before I started. I would have those discussions about funding with your university that you're applying to early. Now, there are all sorts of research councils out there, and I have mine from the ESRC, which is not our traditional one with a medical research council, but I would suggest, if you are going to work, do a PhD that might slip slightly outside of traditional medicine, have a look to see if there's any overlap with any other research councils. And of course, there's the Wellcome Trust as well, and the NIHR as well for funded posts. You then become part of a network where you are further developed as a PhD student, because within the ESRC, we have our ESRC doctoral training program, cohort days. I feel very much part of a doctoral training program, as opposed to when I was on my own doing my PhD without being part of the ESRC DTP. I felt very sort of alone, apart from my supervisor. Once you belong to a funding body, it forms like an umbrella over you, and I would say that is a great way to do this if you can find the route to falling under one of those research councils. Then it's really worth trying.